Before you take that weight loss shot, watch this. We all know somebody that's taken the weight loss shot, they've lost a lot of weight, they don't look really good, their skin is sagging, they don't really look healthy, they seem tired, they seem kind of wiped out, kind of emotionless at times. And so we all say, hey, that's crazy, I don't want to do any of that, that's not for me. Let's talk about this. GLPs are tools. They're actually really fantastic tools, but not everybody does these correctly. Not everybody has the education behind using the tool to make these work like they should. And when you use these tools, diet is everything. And let's talk about this. Diet is not what you don't eat. Your diet is what you do eat. So that becomes even hypercritical when you take these weight loss shots and these weight loss medications. Protein becomes super important more than at any other time when you're trying to change your health through food and diet and lifestyle. So a good rule of thumb to start with protein is 0.7 grams per pound of body weight, and it's going to fluctuate. Everybody's a little different, so talk to your nutritionist or your prescribing doc or whoever you have available and get that dialed in for your specific situation. Maintaining muscle mass is critical when you take these weight loss medications. So your muscle mass is part of what maintains your basal metabolic rate, how much energy you're able to produce in a day. And basically what the mistake that I see a lot of patients making on these medications, which prompts me to want to do this education for them, is that a lot of times they'll take the weight loss shots and then that suppresses their appetite, which is great. They're not having the food noise and they're not snacking like they were. They don't want as much alcohol, and those are all great things. But basically what happens for a lot of the patients is that they don't eat hardly anything at all. And over time that becomes malnourishment. They're basically starving themselves, and there's no way that that's a healthy scenario. So starving yourself is not a healthy option to losing weight. So you don't want to lose body fat along with significant amounts of muscle mass. So you're going to end up less healthy, but just way less on the scale. And the other thing that's super important is exercise. Your body has to have a signal, a reason to maintain that muscle mass. So when you take in the appropriate amount of protein, your exercise habits are going to signal to your body to actually take that protein in and utilize it and maintain your muscle mass and hopefully even build muscle mass during this process. And that's why we do lab work, detailed history on you as a patient, and we do progress checks to make sure that you're progressing as you should, and we make adjustments to the program. So staying on top of all of these details makes you a success with using these weight loss tools. And that's why you always want to consult with either your physician or a functional med physician or a functional nutritionist or your weight loss clinic to stay on top of all of these things. I'm Dr. John Hargrove, and I practice at Holistic Health Center in Savannah, Georgia. You're always welcome to book a consultation with us at hhcofsavannah.com, and we'll see you in the next video. Thank you very much.